Kyle, of the 33 developed nations here in the world, we are the only one that does not have a single payer system. We operate under a healthcare market. A market is driven by profit, and people's opportunity to fully participate in our healthcare market hinges on income. We are referred to as healthcare consumers in the United States. We tend to view healthcare in terms of cost, as opposed to the other developed nations who view healthcare as simply a part of everyday life. The difference then is we're paying far more for our healthcare here and receiving far less beneficial outcomes compared to our more developed nation partners. The healthcare system is designed to care for the patient, and patient care is not hindered by profit.
So what keeps this system running as it is? Because you're describing a very kind of a negative thing, something that isn't working very well, that's very costly, but unfortunately it still is. And I leave that up to anybody who wants to answer it. What is keeping this thing running, and what can we do about it?
Well, I would say it kind of goes back to profit. We, follow the money. We're really driven. We are a capitalistic society that has focused all of our attention on profit. When we, if you go to the State House, we're trying to work on legislation that creates more transparency so we can kind of get down to where that money is going to and how it's being divided. I know last year we were working on surprise billing. When you go for healthcare, have surgery, and you find out that after that surgery in that hospital that you went to that was in your network, you're suddenly getting out of network bills from the anesthesiologist or somebody that worked in the surgery, and you didn't realize you were going to be on the hook for the whole cost. So we really need to start trying to find ways to make things more transparent.
When you think about how we have the system based on for-profit health insurance companies, and I know there are probably people listening who may work for Anthem, which is one of the largest health insurance companies and based in Indianapolis. And the health insurance companies, we're the only country in the world that has this kind of for-profit health insurance. People have all around the world, people have different schemes to try to get everybody covered. But in the United States, we've fallen into this situation. We could talk about the history of it, but basically now we have this patchwork quilt. And so there are people covered by Medicare. Like me, I'm over 65, so I'm on Medicare. There are people who are on the poor end of the spectrum who are covered by Medicaid. There are people covered by the VA, the Indian Health Service, different things. But the majority of Americans are covered by private health insurance, most of which is provided by a fairly small number of large for-profit companies. And they have very high overhead because when you think about their business model, they take income in the form of premiums when we pay our premiums. And then when they pay money out, which is their big business expense, they're paying money out because they're taking care of sick people. But for them to have a profit, to have a margin between their income and their payments, then their incentive is to work to figure out ways not to pay. That's how they are profitable and can support their shareholders.
That I believe more and more people are running into the fact that the system is not running. More and more people are running into the system almost collapsing around us. Before the pandemic began, United Auto Workers went out on strike, and I had spoken to several labor groups in the past, and there was always sort of a theme of, that's good, I want to help the country, but at the moment, and forever, we have a benefit that we have fought long and hard for, and we're okay. We want to help the country, but there's a sense that we're okay. And then I think it was September or October, when UAW went on strike, the first thing General Motors did was said, "Bammo, you folks don't have health insurance anymore." Now, fortunately, their union was able to backfill a bit, over this period. But overnight, I think a large segment of the population realized that, hey, this is nowhere near as secure as we thought. And then, of course, with the pandemic, where we've had, I believe it's 11 million Americans who have lost insurance in the last few months. And of that 11 million who lost insurance because of their employment situation, only 4 of those 11 million were able to find an alternative like Medicaid. So we're seeing, what keeps the system running? I would argue we are hovering on the brink of it completely failing, and we need to come up with a much more secure solution.
Chris just pointed out, why are you pointing at me? And I call this false victimhood. People are dying. We're not pointing at you. We're pointing at the people that we know are rationing their medicines and dying as a result of that. They're the victims here. And I don't want to hear that some organization who's profit driven is somehow a victim because we're questioning the means by which they are gaining those profits. And this is a very clear example of profit over people. And that's what's happening here. And we don't mind profit, but it has become predatory. And we can see it. We can see it in terms of America's diabetics. And I can point to a woman right just north of us in White County, type 1 diabetic. It is cheaper for her and her husband to drive to Niagara Falls, stay overnight, go into Canada, buy her insulin in terms of 3 months supply, and come home to Monticello cheaper. She does all of that, including the trip, cheaper than it cost her to go down the street to her pharmacy to buy the very same insulin. And this is what we have to point out. This is what we're driving home. And this is the problem that Americans see. It's not a secret. If I were to be in a room with someone who was driven by profit, who wanted to convince me they were a victim, I would laugh. And then I would throw them out of the room. We should not tolerate false victimhood in this discussion. If they are willing to spend hundreds of millions of dollars to keep Americans from getting the kind of healthcare system that we need, they are not our friends.
Well, he made me think of a patient I saw not too long ago, a 55 or so year old woman who had her blood pressure well controlled for a long time, and she came in for this particular office visit, and her blood pressure was sky high. And I said to her, what happened? And she said, well, I stopped taking my pills. Well, why did you stop taking your pills? She says, well, I own this house, and I've got my 3 grandkids living with me. And she said, I've got my final eviction notice. And she said, now, I've lived on the street before. I know how to do that, but I will not have my grandkids live on the street. So I stopped, I had a choice, and I stopped taking it. And here's what she said that really kind of, Joe's comment made me start thinking of immediately. She said, so, Dr. Weisbart, how long can I live without taking my blood pressure pills? And I thought, I don't ever want to hear that again. I don't ever want to hear that question again. And then I immediately thought of, how much money the CEOs of the insurance companies are making, and the CEOs of the pharmaceutical manufacturers are making. And sure, they should have a healthy income and such, but how many people like her have to, can't afford, and it's just, no, just no, we have to get this right. We have to get this better. I don't ever want to hear somebody say that to me again.
When people say to me, I don't want to pay for other people's health care, and I say, and so you've got health insurance, and they say yes, and I said, well, that's how health insurance works. All insurance works that way.
Right.
I pay in hoping that I don't get colon cancer, but that's how insurance works, is we spread the risk. And the most efficient way to spread the risk is to have everybody in the same risk pool.
Right.
But then other people say things like, well, I'm not sure there are people, I'm not sure all these people deserve healthcare. And so then I ask, so who doesn't deserve healthcare? I think that's a really big question, because I mean, before I was a hospice doctor, I worked 28 years in the emergency room, and I thought about things like, okay, so if you don't wear a seatbelt and you get hurt in an auto accident, I mean, that's really irresponsible to not wear a seatbelt. Does that mean that if when my ambulance crew is out there and there's one person who's really beaten up because it really smashed up because they didn't wear their seatbelt, and somebody else isn't hurt so bad, but they did wear a seatbelt, should the ambulance transport the not so sick person first because they are more deserving because they took care of themselves, and should they push the person who wasn't wearing a seatbelt back in the queue? Of course not. You know, no one wants to do that. But, you know, so are you undeserving if you smoke? A lot of people say, well, yeah, smokers, you know, they've made themselves sick. And then I ask, well, you know, the statistics are that about 80% of adult smokers became addicted as children. You know, they started smoking before they were 18 years old. And so maybe, you know, maybe there's some reasons why it's really hard to quit smoking, and maybe the tobacco companies have been really good at selling, talking about making profit off of illness. So, you know, you can kind of break this down. And, you know, in the end, I say I think everybody deserves health care.
Yeah, I don't think people realize how that they are just one illness away from bankruptcy. We saw a gentleman who was, you know, basically my husband's age, similar job, similar income, doing well, raising his family, and then ended up with a terminal illness. And we saw him decline. We saw him lose his job. We saw him file for bankruptcy. And you know, and it's shocking. You know, this is a Purdue employee that was still living, but now couldn't work, couldn't pay his bills, and
Right.
that could be us. And
That-
people don't realize that could be you. Talk about not wanting to pay for somebody else's health care. You are paid for their health care when they're on subsidized living at that point. You are going to be paying for that person regardless of you know, when you pay for them. The person that goes in and can't pay for his bills, you know, you're subsidizing their health care. When that bill can't be paid, they're going to raise the costs for you, so that you're covering that cost. So, I mean, this thought that, well, I've got mine, I'm not going to pay for yours, you know, is kind of a fallacy, because that really isn't the case.
This is why elections so desperately matter as a matter of life and death. You know, if we wind up with this new person on the Supreme Court, which I think is probable, most people would say probable at least, there's a really good chance that the Supreme Court will reverse the Affordable Care Act, and we don't have to imagine what the world is like without the Affordable Care Act. Most of us are old enough to remember what the world was like before the Affordable Care Act. Pre-existing conditions, just as one of the things. You know, we all know people who, I personally was refused for when I tried to buy insurance because of having mild high blood pressure. And if you think about it, COVID is going to become a pre-existing condition. We know that something like 70% of people who get COVID, even the asymptomatic ones, the ones who don't even know they had it, on studies, they're shown to have heart inflammation. They don't have to have symptoms of COVID that we all think about, the cough and all that, but an MRI of their heart, 70% of them or so have inflammation in their heart. And we don't yet know, because this is all too new, what that means. Some of them might develop heart failure, they might develop heart disease, blockages. We don't know what that's going to mean, but you can bet the insurance companies, relieved of the restriction of covering people with pre-existing conditions, you can bet they're going to do every game they can to look at people in their policies and say, oh, you had the COVID. We're not going to sell you a policy. That's coming. That's coming. So the best defense against that is to vote. And to vote, again, not wearing my PNHP hat, to vote for people like Joe Mackey.
Well, let me just say this. Chris Campbell, you have been my friend ever before we got involved in politics, before you were elected. I'm very proud of you. Your voice at the State House really is a voice of reason. And I want to thank you for everything that you do for your community, your district. I know you're fighting what seems like an uphill battle. It takes a real warrior to kind of armor up and go to Indianapolis and engage. So thank you for that. Dr. Ed Weisbart, I mentioned earlier, I follow your videos. I know you're a phone call away if I need you. Physicians for a National Health Plan is a wonderful organization. I encourage people to go out and look at pnhp.org and educate yourselves. They are nonpartisan and they are educational. And I think they do a wonderful job of really breaking down the dilemmas that we have with the current healthcare market we're caught up in. And I think they do a wonderful job of explaining and doing comparative analysis between how Americans receive healthcare and the rest of the developed world. And I want to thank you for joining me tonight, joining all of us. I know that you're busy, but believe me, your voice is a voice of reason. And I'm so grateful that you were able to join us. My friend, Dr. Rob Stone, when we first met, as you pointed out, I viewed you as a candle in the dark. I knew something needed to be done. I was like most people in that I could point out what I didn't like. But at the end of the day, just pointing out what you don't like is just really griping. And you really kind of lit up the room and you pointed me in a direction that clarified things. It makes what I do today much better. I'm much better because of the education I've received from PNHP, from you, Dr. Stone. I encourage people to go out, Medicare for All, Bloomington, engage and learn. And the more you learn, the less you will be afraid of the gaslighting organizations out there that really want to blow the issue up and keep us afraid of actually challenging the healthcare market that we have. The sun comes up tomorrow. It's a brand new day. I say that every day. Tomorrow's a new day. That's how I continue on. Half the battle is getting to Washington. The other half is convincing everyone that, this is a must. I don't think it's going to be as hard next year as it has been the last several election cycles. There's a lot to learn. It's a complicated issue. There's no time like the present to get started educating yourselves. I want to thank everyone who joined us tonight. Thank you, Kyle. You did a wonderful job. And I do wish you all well. November the 3rd is coming, and I encourage everyone to go out and vote.